Hello, everyone. My name is Bob Gerlach. I'm the Health and Welfare Benefits Manager here at WestPath. Thank you very much for joining this webinar on HealthFlex plan changes for 2024, specifically geared towards those of you who are currently in the H2000 with HSA today. If you are not currently in the H2000 today, while you are welcome to join, this may not be the webinar for you. So please feel free to log into Benefits Access and see what other webinars are available and will be available for the other plans. My objectives today are to make sure you learn about the 2024 HSA plan changes and confidently understand how the new plan compares to the one you're in today. And then I also want to make sure you feel prepared to make your 2024 HealthFlex selections. We're making these plan changes because the minimum deductible for HSA plans is increasing in 2024. That meant that the H2500 plan, the gold HSA plan today, would not be compliant next year. So we've changed all of our HSA plans for 2024 with two objectives in mind. First, to keep and create a variety of HSA plan options for you, and also to avoid the need for annual changes going forward. Today, we're specifically talking about the new H2500 plan, which is replacing the current H2000 plan. This is our silver HSA plan design. When we look at the old H2000, the H2000 of today, and the new H2500 for next year, as I said, these are our silver HSA offerings. The individual deductible on the plan and the family deductible on the plan will increase in 2024. So the H2000 has a $2,000 individual deductible and a $4,000 family deductible. In the H2500, we will have a $2,500 individual deductible and a $5,000 family deductible. The coinsurance will remain the same at 70%, and the out-of-pocket max will also remain the same at $5,000 for an individual and $10,000 for a family. In order to maintain the H2500 as a silver plan in 2024, we did have to reduce the account funding from $500 and $1,000 to $250 for an individual and $500 if two or more people are covered. The H2500, as I said, is our silver offering, which means it's our mid-level HSA plan. We think this is the best plan for people currently in the H2000 who want the closest equivalent plan next year. It's also geared towards a more experienced HSA plan user who wants to have more savings and is ready to contribute more to their HSA plan. It does have a lower amount of HSA funding included in the plan. It's half of what it was in the H2000 in 2023. And there is an increase in the deductible versus the H2000. But as I said, same coinsurance and same out-of-pocket maximum as the old H2000 plan. The other thing I want to draw your attention to is that in 2024, we will have a new H2000 plan. This will be the gold level plan replacing the H1500. So if you select that plan thinking it's the closest plan to what you have today, it is not. It is a more generous plan than the H2000 today because it is a gold plan and not a silver plan, and it will have an increased premium, more so than what you would normally see in a rate increase year over year because the plan is more generous. I've got some examples I want to walk you through on how the plan pays differently. So specifically looking at how the old H2000 plan of today pays compared to how the new H2500 plan will pay in 2024. So my first example is a cardiology outpatient visit with testing. The discounted cost of this service is $1,500. In the old H2000 today, you have a $2,000 deductible and $500 of account funding. So your total cost is going to be the full cost of $1,500 because you have not yet met your deductible. So that $1,500 will go towards your deductible. And your total out-of-pocket will only be $1,000 because for this example, we're assuming that you're going to use the $500 in your HSA to pay for this service. In the H2500 plan, you have a $2,500 deductible for employee-only coverage and $250 in account funding. So just like in the H2000 today, the $1,500 is not going to get you to your deductible, so you're going to pay the full discounted cost of $1,500, and then that'll be reduced by $250 that you actually pay when you apply the $250 in your HSA to this service. So your total out-of-pocket cost is $1,250. Now let's look at a more expensive service that causes you to meet your deductible. For this one, I'm showing you an appendix removal. The discounted cost of that service is about $6,000. In the old H2000, the H2000 Silver plan of today, you still have a $2,000 deductible and $500 in account funding. Your total cost for this service is $3,200. You pay the $2,000 to meet the deductible, and then the plan pays 70% and you pay 30% of the remaining $4,000, which is $1,200. But your total out-of-pocket cost is reduced $500 by having that money in the HSA, so your total cost for this service is $2,700. In the H2500 plan, again, $2,500 deductible, $250 of account funding. So your total cost in the H2500 is $3,550, $2,500 to meet the deductible, and then 30% of the remaining $3,500, which is $1,050. And then your total out-of-pocket is reduced by $250 by using the money in the HSA, so your total cost for this service would be $3,300. I'm now going to walk through some medication examples so you can see how the H2000 of today pays the same as the H2500 of 2024. When we look at an HSA plan, before you meet the deductible, you have to pay the full discounted cost of the medication. So this is an example of generic medication, where the 30-day supply costs $110 and the 90-day supply costs $330. In the old H2000, the H2000 Silver plan of today, you pay that full discounted cost of $110 for a 30-day supply and $330 for a 90-day supply. And that's because you haven't met the deductible yet in this example. In the H2500, you would pay exactly the same, the full discounted cost until you meet the deductible. But let's say your prescription drug is on the preventive medication list. So we'll look at the exact same prescription drug that's a generic and costs $110 for a 30-day supply and $330 for a 90-day supply. When you're in an HSA plan, if your medication is on the preventive drug list, you bypass the deductible and you pay the copay. That means for the H2000 of today, the old H2000, and the H2500, or the Silver HSA plan for 2024, you would pay the same generic cost for the drug, $10 for a 30-day script, $25 for a 90-day script. And you could find the full list of preventive drugs at welcome.optumrx.com/westpath, or more easily by logging into your Benefits Access account. I'm now going to show an example of a preferred brand drug, first the non-preventive, and then if it's on the preventive drug list. So this is a prescription drug that costs $267 discounted for a 30-day supply and $726 for a 90-day supply. In the old H2000 today, again, you must meet the deductible before the plan pays further than the discounted cost of the medication. So you would pay $267 for the 30-day script or $726 for the 90-day script. Once you've met the deductible, then you would pay the copay. In 2024, the H2500 cost would be exactly the same. $267 for a 30-day supply, $726 for a 90-day supply. And that's again until the deductible is met. If your preferred brand drug is on the preventive medication list, we're looking at the same drug, the one that costs $267 for a 30-day supply and $726 for a 90-day supply. You bypass the deductible and you pay the amount you would pay as if the deductible had been met. So in the H2000 and the H2500, the cost share is 30% coinsurance that you pay once the deductible has been met, or in this case, when we're bypassing the deductible entirely. Now, the cost of this drug, 30% of this drug, exceeds the maximum that you would pay for this drug. So we instead apply our maximum cost to you, and that's $65 for a 30-day script and $165 for a 90-day script. And the cost is exactly the same in the H2500. As someone who is most likely, since you joined this webinar, currently in the H2000 plan, we wanted to reiterate some of the wisdom in choosing an HSA plan. First, want to make sure everyone understands that just because a plan costs more does not necessarily make it better. Each plan covers the same services and offers the same quality because they're using the same network. Our analysis over the last several years has continued to show that over 90% of people actually save money in an HSA plan over other plans. When you are looking to make your choice for 2024, please make sure to consider what you pay in premiums each month to have that plan. When you look at your total out-of-pocket cost, it is the money that you pay on services plus what you've paid to have the plan. To estimate what your costs were, if you know that you're going to have some of the same services year over year, you can always look at your explanation of benefits by logging into Benefits Access and clicking over to your medical plan. And you can always use tools like Alex. Alex has been updated for 2024. There's a link to Alex again in Benefits Access. You let Alex know what your services are likely to be, and then Alex is going to crunch the numbers and tell you which plan is likely to be the lowest cost plan for you. And will additionally let you know, especially in an H2500 plan, for example, how much money you should consider putting into your HSA to offset those costs. And if you choose a lower premium plan than you've had in the past, we think a good rule of thumb is to plan to put some or all of those premium savings into an HSA so that you have the money available when you need to pay for those services before the deductible is met. Annual election this year will still be done through Benefits Access. Additionally, we've put all the HealthFlex information, all the annual election information in Benefits Access to allow us to have targeted messaging and personalized information, including that Alex link. So feel free to log into benefitsaccess.org and look into even more information than what I'm sharing today about annual election. Annual election will begin on November 1st and go through November 16th. The current H2000 plan is going away, so if you do not make an election for 2024, we will automatically move you into the new H2500 plan because that is the closest plan to what you have today. And we did not want to just leave you with no medical plan for 2024 if you do not make elections. Your current dental and vision elections will automatically carry over, but if you want to contribute to an HSA or even an FSA, you do need to log in during annual election and make those elections each year. At this point, please feel free, if you haven't done so already, to start typing your questions into the questions module, and I will address those as they come in. While you are thinking of questions, I wanted to let you know of a few things. First of all, this is not your only opportunity to ask questions. We will send out a link to the recording of this webinar in the coming days. You can reply to that email with questions if you have them, especially if you have questions that are more sensitive that you do not want to share with the entire group. Perhaps you'd like to keep it anonymous. We are happy to do that. There are also a couple webinars that I wanted to make you aware of. This Thursday, we have our annual election webinar that is going to cover all of our plans for 2024. So you can join that, learn about the other plans, and ask questions. And then during annual election, I believe it is November 7th, you can join for our first Q&A AE webinar, where you can just join and ask any questions that you would like at that time. You can always reach out to the Active Benefits team here at Westpath. And you can, as I said, continue to put questions into the questions module today, and we'll address those as they come in.
We got a question here. Can I reimburse myself from my HSA if I had to pay up front with a credit card because I didn't have enough money in it yet?
So, excellent question that came in. Can I reimburse myself from my HSA if I put money on a credit card because I didn't have the money available? Yes, you can. There are some people who actually like to put, even if they have the money in their HSA, put it on a credit card that they get points on and then reimburse themselves from the HSA as well. A little tip, if you have an HSA and the money is not all there yet, most providers are happy to hear that they are going to get paid and not need to worry about sending you to collections. So if you have a service early in the year and you anticipate that money to eventually hit your HSA over the next 3 or 6 or 9 months, you should talk to that provider about putting you on a payment plan. You can actually give them the numbers off of your HSA card, and they could charge you an agreed upon amount every month. And then once the money comes in, just let them know the money always comes in on the 5th. Have them sweep it. I would tell them maybe the 15th of the month, let them know the money will be there, and take $200 or $150 a month or whatever it is, and they could take it out that way. The other thing you can do is, if you have the money put aside already, maybe just in your savings account because it was a truly unexpected event, you can deposit that money directly into your HSA and then have it pay through to the provider, and then you get the tax benefit because you could claim that contribution on your next year's taxes.
Another question is, how does a retiree contribute to an HSA?
Okay. The next question, how does a retiree contribute to an HSA? Well, first you would have to make sure that you are eligible to contribute to an HSA as a retiree, which means you are most likely a pre-65 retiree, or you are a retiree who has deferred Social Security and Medicare Part A and Medicare Part B. That second part is less likely. Generally, we see those contributing to an HSA to be pre-65 retirees. In those cases, because you do not have a paycheck to have those contributions taken out of, you would need to contact Health Equity directly. You make payments to them, which they will deposit into your HSA, and then you claim those on your taxes. But for any HSA contributions, whether you are retired and under an over 65, or you are over 65 and continuing to work, I recommend contacting EY to ensure that you are doing the appropriate contributions so that you are not breaking any of the IRS rules.
Somebody's asked if they can see the brand prescription comparison examples again.
Sure. So brand prescription examples right here. This is preferred brand if the deductible has not been met and if it is not on the preventive drug list.
Can you keep this up? I'll ask another question.
Sure.
One individual is confused because they see the H2000 listed for 2024.
Yes.
I just heard that the H2000 will be discontinued. Can you please clarify?
Yes. So the question about seeing the H2000 listed for 2024 when we just heard that it's being discontinued. When we looked at the plans we wanted to have starting next year, knowing that we needed to be compliant with the IRS rules, we felt that the new gold HSA offering in 2024 should be the H2000. And we knew that we couldn't have two H2000 plans because it's already going to be confusing that we have a new H2000 next year. So the H2000 that's being discontinued is the silver H2000 plan, which is being replaced with the silver H2500 plan. The H1500 plan of today is a gold plan. We're replacing the gold H1500 with a gold H2000. And we know it's confusing to have two plans with the same name that are very different from one year to the next. But when we looked at the suite of plans that we have available, what they cost, what are most beneficial for people, where people are enrolling today, we packaged all those things together and wanted to be forward-looking and not have a plan that needed to be changed again in a year. We landed on the H2000 being the plan that we really had to have as a gold level plan, the H2500 as the plan we had to have as a silver plan, and then we have a new bronze offering for next year, which is the H5000.
If someone doesn't enroll a spouse for 2024, but the spouse loses her job, employer coverage, can the spouse be added to a HealthFlex mid-year?
So this question that came in is about what happens if you do not enroll your spouse during annual election, but then your spouse loses coverage for whatever reason. Can you enroll them during the course of the year? And yes, you can. A spouse or other dependent losing coverage is a qualified life status event, which means you have 30 days from that loss of coverage to enroll them in HealthFlex.
If I can afford the gold new H2000, is there any reason I might be better off in the silver H2500?
So this question, the question is, if I can afford the new gold H2000, is there a reason why I should not take that plan and I should instead choose the H2500 or a different plan? So I'm now going to jump to this wisdom of choosing an HSA plan screen. And what I want this individual or anyone who's thinking about this to consider is, what am I getting in the premium by choosing a more expensive plan? So what you want to look at is, what are my total costs going to be for my anticipated services plus what I pay each month to be in the plan? What we have found is the two easiest points of reference for choosing a plan are, what if I use very little care, and what if I use a whole lot of care? And what we have found, doesn't mean it applies to everyone, this is talking about percentages, is that most people who have very little care needed during the course of the year benefit from having the lower cost plan. And most people who use a ton of care each year and hit their out-of-pocket max would also benefit from the lowest cost plan. The second one is easier to understand. Every single plan has the same out-of-pocket max. So if you're going to hit $5,000, regardless of which plan you choose, and that's the cap on what you would pay during the course of the year, then you should consider paying the least amount in premium. Because total cost is premiums plus what you pay for services.
What if you need to change from an HSA plan to something else? How can you find out more about the other plan option?
So the question is, what if you need to change from the HSA plan to something else? So because I heard need to change, that means it's probably someone who's no longer eligible to contribute to an HSA. I would recommend looking at the plan comparison brochure that's available on benefitsaccess.org. You can also join the webinar this Thursday that's going to talk about all the plan differences across all 6 plans in 2024. If you have money in an HSA plan today and you are not in an HSA plan next year, either because you're no longer eligible to contribute or you are going to be retiring and taking a retirement plan outside of HealthFlex, that HSA money is still yours. It carries forward to next year, and you can use that money for any of your healthcare expenses. If you're retired, you could use it for Medicare premiums. And if you say, I have enough money and I want to use this for something else, once you retire, you can take money from your HSA plan and use it for anything you wish. You just pay normal taxes on it. But it's tax-free as long as you use it for healthcare services.
How much HSA money is included in the new Gold H2000 plan?
Question, how much HSA money is included in the new Gold H2000 plan? First, let me share that we did record another webinar on the change from the H1500 to the H2000. That might be a place that you can refer back to if you want information. But the new H2000 plan, the new gold plan for 2024, will have a $1,000 HSA contribution for an individual and a $2,000 contribution for 2 or more people covered.
How is it determined if a drug is preventative?
The question, how is it determined that a drug is on the preventive drug list? That's a really, really excellent question. We do not have any say in what drugs are on that list. I will probably miss some of the decision makers there, but certainly CMS, the Center for Medicare and Medicaid Services, has some say in what goes on that list. It's a pretty extensive list. If you go out there, the goal of that list is to have the drugs that people need to take all the time, right? So what you'll see on that list are a lot of blood pressure medication, heart medication, diabetes medication. There are some mental health and behavioral health drugs on that list, and a whole suite of others. Honestly, if it was up to me, which it clearly is not, anything that someone needed to take every day would be on that list, right? But that is not the case. But it is a pretty extensive list. There are hundreds of individual drugs on that list.
Is it too late to add HSA funds to the HSA in 2023 if someone has an unexpected expense?
So question, is it too late today on October 23rd, maybe today is, to add money to your HSA if you have some unexpected expenses that arose? No, you can make contributions as long as you haven't exceeded your IRS limit. You can make contributions through the end of the year. You can actually make 2023 contributions up until tax day in 2024. So if you find yourself where, I don't know how likely this is, but if you added a few $100s to your HSA, you would owe $0 to Uncle Sam. You can make that contribution to the HSA into 2024 and claim it on your taxes.
We're just waiting for another question.
Okay. As you're thinking of more questions, do not forget that we will have other opportunities for you to ask questions, as well as those other webinars you can join to get more information about HealthFlex.
This is my first year in an HSA plan. I don't have a lot of money saved. I want to save more in my HSA. How do I know which plan to choose?
So question is, this is my first year in my HSA. I do not have a lot of money saved. If I want to save more, how do I know which plan to choose? My recommendation is always going to be to utilize Alex to see, based on what you think your care is going to be and Alex's estimation of what it would cost, what plan Alex says that you should choose. Once you see what Alex has recommended, Alex is also going to tell you, based on your utilization, here's what you should probably put aside into an HSA plan. I'm assuming Alex, for this scenario, says choose this HSA plan. Because that's going to be the amount that covers what your expenses would be, so you get those tax-free. If you are choosing a lower cost plan than you've previously had, certainly consider putting those saved premiums into your HSA. That's one of the best ways to prepare for those expenses needing to hit your deductible first, right? That you need to meet the deductible before the plan kicks in, maybe what you're used to in the other plans. And then it's a good way for you to track, how much you've been able to build up your HSA. You can make contributions up to the limit to your HSA at any point. You can contact Health Equity and put money in. So I've heard of people who, get all of their health cash through HealthFlex, the $410 for an individual, and that applies to participant and covered spouse. Maybe get that money to your checking account and then deposit it to your HSA if you didn't have that earmarked for anything else. So there's a variety of different ways that you can add money. I am an advocate for always being properly insured. I think that we just, as a rule, tend to be worried about expenses and end up being overinsured. So to me, the best thing you could do is make sure you're properly insured. And usually if you are properly insured, you're able to save some money on premium versus being overinsured. And then you could put that in your HSA. That's a great way to save money for the future.
Can a spouse who is 68 but not signed up for Medicare be covered under the H2500 plan?
So can a spouse who is over age 65 but not enrolled in Medicare be covered in the H2500 plan? So you're getting into a tricky zone there, right? Because you are over 65, have not taken Medicare Part A or Part B, and also to be eligible for the HSA, you must not be receiving Social Security. So this would be an extremely uncommon scenario. I would actually, in that case, recommend reaching out to EY because it's a scenario I haven't even heard of someone being 68 and not taking Medicare Part A, Part B, or Social Security, because receiving a Social Security payment also makes you ineligible for the HSA. They can be covered in the plan. What I would be concerned with is if the primary participant is eligible to make contributions, you'd want to make sure that if you are counting on that 68-year-old spouse to allow you to make the family contribution, that they check all those boxes as far as being eligible for the HSA by not being enrolled in Medicare or taking Social Security.
Does the plan contribution mean the maximum amount I can have deducted from my paycheck to put into my HSA?
So the question is, does the plan contribution mean that it's the maximum you can deduct to put into your account? No. The plan contribution, I'm going to back up and show it here. The plan contribution is the money that is built into the plan and available on day one. So if we look at this slide here that we compare the new 2500 to the old 2000, that second hash mark that says HSA funding included in bold, it's $2,500, or I'm sorry, in the H2500, it's $250 for an individual, $500 if 2 or more people are covered. So that money is built into the plan to help offset those costs early in the year, give you a jump start on saving in your HSA. It reduces the IRS maximum for the year because the IRS maximum defines the total amount that can go into the HSA for any reason. But you do not pay taxes on this amount. You do not report this amount as income. It just goes against the limit for the year.
Can you talk about how you decide between an H2500 plan and an H5000 plan?
Sure. So how do you decide between the H2500 and the H5000? Now, the H5000 is a new plan that we haven't talked about today. It's a very unique plan to HealthFlex. It's our first ever deductible only plan. We're going to be having a webinar talking about the differences between the H3000 and the H5000, and that recording will also be posted online if you wanted to look at that. To me, when you're looking at choosing between plans, it really doesn't matter which plans you're choosing between. I like to always take the same approach. One is recognizing that the out-of-pocket max is the same across all plans. So what you spend out of pocket is capped at $5,000 for an individual and $10,000 for a family for in-network covered services. So now what you're looking at is really what the premium is, right? Because you want to understand the premium differential because that's going to be a big part of what your total costs are throughout the year. And then what services you have, right? Because the types of services you have could have you lean towards an HSA plan or towards an HRA plan, or for a very, very few people, towards the B1000 plan. The best recommendation I have is still to look at Alex, because Alex is going to crunch the numbers and based upon the information you provide, say, this is likely to be the lowest plan for you. Would you like to hear why? And then to me, I always want to hear why, especially in the case where it's not the plan that I expected to get recommended. And you're going to see, worst case scenario examples, all of those things, and also get that recommendation for how much money you should put in your HSA. And the great thing about that is that tells you how much money you should expect to spend out of pocket, right? Because Alex's up to the limit is always going to tell you to put the amount of money you need to meet your expenses.
Can you please explain the gold, silver, bronze? Alex recommended H5000, but since it's called bronze, it feels like it's not the best plan.
So, question, can you explain the difference between gold, silver, and bronze? Alex recommended the H5000, which is a bronze, and that really doesn't make sense to me. HealthFlex years ago, after the Affordable Care Act announced exchanges and had their metal ranking for plans at platinum, gold, silver, and bronze, decided that we would also, to make it easier for people to understand, have our plans get that metal designation of gold, silver, or bronze. At the most granular level, gold, silver, and bronze refer to the actuarial value of the plan and what percentage of the plan or what percentage of expenses the plan covers. But we feel that's a little one-dimensional because it does not at all take into account what a plan costs, and what a person is likely to have to spend out of pocket to have that insurance. So we really think from a HealthFlex perspective, especially since all plans have the same out-of-pocket max to cap the amount you would pay in a given year for covered services, we like to look at them as what you're paying to have this plan. So the gold plans have the highest premiums. The silver, when we say it's the mid-level plan, we mean from a premium perspective. And the bronze is the least expensive plan. So we have 3 gold plans, 2 silver plans, and a bronze plan. The HSA, because it's such a powerful savings tool and because really that is the future of health plans is really largely around HSA plans. So we've decided to offer one at each level, a gold, a silver, and a bronze. And we've done that for a number of reasons. First and foremost, because we know that people are probably not very comfortable jumping right into a bronze plan with a higher deductible, that they're not sure how that's going to work for them. So we think it's a really good plan to have multiple options where people could say, well, I'm going to do gold for a year and then silver for a year and then bronze for a year, or I'm going to see how it goes, right? So when we look at actual claims data and we look at what plans are the most beneficial for people, when I say beneficial, I'm talking about cost, so the lowest cost plan, we find that overall, about 2/3 of people in HealthFlex would pay the least in the H5000 plan. And it's really because you have to look at what the plan costs each month. If you are not meeting your deductible every single year, then the most expensive part of your healthcare coverage is the premium every month. So the more you can drive that cost down, the more money you're going to save.
What are the 2024 HSA contribution limits?
Question is, what are the 2024 HSA contribution limits? If one person is covered, the 2024 HSA contribution limit is $4,150. If 2 or more people are covered, it doubles, and it's $8,300. If you are over age 55, you can add $1,000 to each of those numbers, right? So it becomes $5,150 for an individual, $9,300 for a family. Those are IRS rules. They set that it's the same $1,000 regardless of how many people are covered. And please note that the limit includes any money that's built into the plan. It includes any money that you put in, and if you have excess premium credit left over that goes in monthly, it also includes that money. The limit is the total sum of what can be deposited into an HSA during a calendar year.
How long can you keep money in your HSA? Can it be used for dental vision?
How long can you keep money in your HSA and what can it be used for? Once money is in your HSA, as long as it didn't go in by mistake, and as long as you are eligible to have that money in the HSA, it stays in there forever. You take it into retirement. You can even leave it to a beneficiary. Money in a health savings account while you're an active employee can be used for any medical services, so medical, pharmacy, behavioral health, dental, and vision. Once you retire, you can use that money for those same services plus for Medicare premiums. And then after you retire, you can take the money out for any reason you wish and just pay taxes on it at that point. If you're using it for covered medical services, dental, pharmacy, behavioral health, vision, or Medicare premiums, it's tax-free.
When do you receive contributions to your HSA account? If I'm retiring in June, will I receive the full amount for whichever plan I choose?
So when do you receive HSA contributions in your account? And if I'm retiring in June, how much do I get, right? So the money that's built into the plan gets deposited right around the first of the year, one-time deposit. Personal contributions that you are making post on the 5th of the month. So IRS rule says that the money has to come out of your paycheck before we can post it. Administratively, we can say that we expect it's out on the 5th, so we post it on the 5th. Excess premium credit also posts on the 5th. If you retire in June, so if you retire effective June 1st and you make personal contributions, you can only make personal contributions for January through May through your salary deferral. If you're retiring but still eligible to make contributions, you can go directly to Health Equity and still make contributions to them. But you have to still be eligible to make contributions. That means no Medicare Part A, no Medicare Part B, and no Social Security at the base level. If you are not eligible for an HSA plan at all upon retirement, so you're 65 and taking Medicare in June, or you're collecting Social Security, then for 2024, your maximum contribution to the HSA is only 5/12 of the amount, right? Because you're only eligible for 5 of the 12 months.
We're waiting for another question.
We have a couple more minutes for questions. So this next one, if one comes in, is going to be the last question that we'll have time to take. I definitely appreciate all the questions. Please consider, if you have other questions, reaching out in the other ways that I've mentioned.
We have one coming, and this would be our last. Can you add extra money to your HSA after your enrollment date?
So the question is, our final question, can you add extra money to your HSA after your enrollment date? Yes. You can contact your benefits office or your human resource department to up your HSA contribution at any point throughout the year, or you can make those contributions directly through Health Equity and then just remember to claim them on your taxes. The only rule is that you have to make the deposit by tax day and you cannot exceed the annual limit.
Okay, this is right.
All right. Thank you all very much for joining today. I appreciate all the questions. Please utilize Alex to get a recommendation for your plan for 2024. Please make your annual election choices between November 1st and November 16th. And I hope everyone has a great day.